it's important to stay active. So regular exercise in most patients with scleroderma is a good idea. Patients should listen to their body, not push themselves to the point of significant pain or significant breathlessness, but have discussions with their doctors about what level of exercise is important. It can help maintain muscle mass, it can help maintain flexibility and reduce fall risk in patients. Now, in patients with more significant contractures who are limited in their mobility, I tend to encourage more physical therapy rather than independent exercise, just so that it's done under a more monitored setting and in a more gradual manner. So coping in scleroderma can be a challenge. Many times patients are saying goodbye to their formal self, at least for the short term, sometimes for the longer term. And so I do encourage patients to talk about it. Sometimes patients will go to therapy. If there's depression involved, we definitely try to manage the depression because that can make a big difference in how well they're able to comply with medication regimens, come to appointments, and continue relationships with family and friends who support them. I also encourage them to try to continue to focus on something that they're passionate about, whether that be an activity, reading books for pleasure, traveling, or even engaging in forms of exercise or meditation or connecting with their faith. I think all of those are different ways to continue to cope, and everybody has a different approach, but it's about finding what works for you. Yes, I think there is a lot of hope for patients with scleroderma. First of all, I always tell my patients that there's a huge spectrum of patients who have scleroderma. So some patients do have severe disease, but many, many others have very mild disease that progresses little over the course of a lifetime. And so it's important to keep that in mind and important to remember when you see other patients with scleroderma or you read about scleroderma online that there are a variety of presentations and outcomes. When scleroderma is caught early, many times we can get it under control and it can be managed. While there may not be a cure in patients, in all patients, and some patients may end up on some sort of medication for life, it can be managed. It's harder to reverse damage in patients who already have, for example, a lot of fibrosis in their lungs or a lot of damage to their gastrointestinal tract. That can be a challenge. But in most patients who are able to catch early, I do have a lot of hope.